Thanks, Ryan. A typical New Year's resolution is exercise, and joining us today to discuss how it benefits heart health and when to exercise after having COVID is Hartford Healthcare cardiologist Dr. Anya Wagner with Heart and Vascular Institute at St. Vincent's Medical Center. Doctor, welcome.
Thank you for having me.
Great to have you. So how does exercise decrease the risk of cardiovascular disease?
So exercise is really the best thing to decrease your chances of having a heart attack or stroke. Exercise decreases your blood pressure, decreases your heart rate, improves your cholesterol profile, decreases your blood glucose, and helps you to maintain or achieve a heart healthy weight.
All right, what types of exercise do you recommend for the most health benefits?
So 30 minutes a day for 5 days or 150 minutes per week of a combination of aerobic exercise as well as strength exercise are recommended.
All right, the big question, running versus walking.
So it depends. For somebody who really hasn't exercised for a while, the best thing is to start slow and then slowly, really gradually increase your intensity. And walking is a very safe way to start any exercise program.
All right, for people who have cardiovascular disease or an underlying heart condition, what precautions should they take?
So anybody who has an underlying heart diseases or symptoms worrisome for any underlying heart diseases or any cardiovascular disease should really consult with a physician before they start an exercise program.
All right, what about a lot of people are getting COVID right now. Can someone with COVID work out?
So absolutely not. So anybody who has an acute viral illness should not work out. And even if you recover from COVID, for example, and do still have symptoms, you should be seen by a physician prior to starting an exercise program.
All right, when can someone exercise after they've had COVID?
That is currently really a question of a debate, and really every case is different. But an otherwise healthy person who had a mild course of COVID and completely recovered and had really no symptoms for 7 days can start a mild exercise program. And a light exercise program is something they should really start with 50% of the volume and the intensity of exercise that they did before. And they should do this for 1 week and then really gradually increase their intensity. But everybody else who still has symptoms or had a more severe course should be seen by a physician prior to starting an exercise program.
All right, Dr. Anya Wagner with Hartford Healthcare St. Vincent's Medical Center in Bridgeport. We thank you very much.